Very good morning, all. Today I will discuss regarding one case report which we are published in the IGPP. So this is 11 months infant came to nearby village with history of fever, altered sensorium and seizures. They came to on the day 3 of illness. So this is a straightforward fever, seizures, altered sensorium with suspected meningitis. As we discussed in last video, child was sent after investigation sending, child was started on ceftriaxone, vancomycin, artesunate, dioxin, and aceclofenac. Based on investigation revealed there is a elevated inflammatory markers. So and we done CSF analysis which suggests of a very low glucose serum level, elevated proteins, and CSF culture and gram strain was sent. As nowadays there is a definitive indication of identification of organisms there, we sent for the biofile. And the child was on the treatment and antipill was started. After 24 hours, we got the biofilm report. There is a growth of streptococcus pneumoniae. So you should worry because streptococcus pneumoniae is one of the pathogen causing a very poor progress in the meningitis. So child started getting response to antibiotic, remaining drugs were stopped, only ceftriaxone and vancomycin was continued. Day 4, child developed the chorioetheritis movements and nystagmus movements. Fever spikes reduced, inflammatory markers reduced, but child neurological symptoms are worsened. So we thought that there is an immunological phenomenon and we done MRI scan. It is like a vascular infarcts are there. So whenever child getting better like fever spikes wise, sepsis wise, but worsening neurological symptom, we have to suspect immunological manifestations. So once there is a vascular infarcts are there, immunological manifestation there, we started high dose pulse methylprednisolone. There is a very little literature regarding this one, but we don't have any option. Fortunately, after starting IV pulse methylprednisolone, day 4, day 5, child getting better, and we will continue over the 4 to 6 weeks of the steroid medicine and warily change it to the antiepileptic. Here, few points we have to know that. So, as child was previously completely immunized, now we are know that government is providing pneumonia vaccination. This 11-month child got 2 doses, 6 weeks and 14 weeks, and a booster dose was received in 9th month till he developed streptococcus pneumoniae. So, what is the reason? Then we thought that is there any possibility of the immunodeficiency? Then we sent for this one. Each child has a completely all immunoglobulins are low and B cells are the normal. So this is the condition where we have to see all immunoglobulins are low, B cells are abnormal. We think of X-linked brightness A gamma globulinemia. But here immunoglobulins are low, B cells are normal. We thought of CVID. That but CVID presentation in this group is very rare. That way genetic test was sent, reports yet to come. Here I want to tell the 3 points routine for in the pediatric thing. Fever, altered seizures, you suspect meningitis. Why? Because up to 12 to 18 months, proper meningeal signs won't develop. Even after that also, only 50% cases only have the meningeal signs. Remaining 50% case doesn't have a meningeal signs. Second one is the identification of organism very much important. Why? Because the duration of antibiotics also important. For streptococcus pneumonia, there is a 10 to 14 days. Each influenza 7 to 10 days. There is a gram-negative sepsis, we have to give the 3 weeks. For the duration, for the prognosis, we have to be identification of organism must. Third most important, when there is a severe infections, always keep mind in that immunodeficiency. Thank you.